Can therapy really help my emetophobia? Yes, it can. Let's explore how therapy for emetophobia works. Most people find vomiting unpleasant, but for those with emetophobia, it feels like a life-threatening crisis. This fear is driven by four main glitches in how the brain processes risk. The first is the overinflation of how severe vomiting is. Those with emetophobia often see vomiting and nausea as the worst thing ever. They can often feel that vomiting is dangerous and will lead to choking, dying, pain, or that it is even worse than death. The second is overestimating how likely being sick is. Those with this phobia can start to see vomiting as much more likely than it really is. Even if you have not been sick in a decade, your brain tells you it could happen at any moment. The third glitch is the lack of self-belief in your ability to cope. As vomiting is seen as completely awful, those with emetophobia often doubt their ability to handle the sensation of being sick or the intensity of the anxiety itself. The last main glitch is having sensory intolerance. Often sufferers struggle to accept normal, uncomfortable physical sensations, like indigestion or nausea, without labeling them as a danger and becoming anxious in response to them. So why doesn't emetophobia get better on its own? You might wonder why these fears don't just fade away over time. The reason is the constant use of safety behaviors, any action we take to prevent our fears from happening. Whether it's checking food expiration dates excessively, avoiding certain places, or constant hand washing, these actions are meant to prevent vomiting, which in the short term sounds like a great thing. However, they actually keep your fear alive. Because you are always preventing the disaster, your brain never learns that the disaster is actually unlikely or less severe than you anticipated. This causes you to stay trapped in the belief that your actions are the only thing keeping you safe. Therapy helps to fix this by breaking this cycle. Instead of avoiding your fear, the goal is to systematically change those four beliefs about vomiting. The first therapy aim is to help you learn that while vomiting is uncomfortable, it is a brief, natural bodily function that is safe, not a catastrophe. The second aim, and a big part of therapy, is to help you realize that the actual likelihood of vomiting is much lower than your anxiety suggests. Therapy also aims to increase your self-confidence by proving to yourself that you can handle uncomfortable sensations and that you are stronger than your anxiety. Lastly, a big part of therapy is learning to sit with weird stomach sensations without trying to fix or flee from them. The core of the treatment is simple, but requires bravery. Stop trying to prevent vomiting. When you drop the safety behaviors and face the uncertainty, your brain finally gets the evidence it needs to change its opinions on vomiting. Once your view of being sick shifts from awful and likely to manageable and unlikely, the fear loses its power. You can move from a life of constant scanning and worry to a life of freedom.